Welcome to Kindly Neurodivergent with Kay. Today I have Dr. Davidson with me. She will be discussing nasal function. Welcome, Dr. Davidson.
Good morning, Kayla. Thank you so much for having me. This is such an honor and a great opportunity. Thank you.
Before we start, a quick note. This episode is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. And if you notice any pauses during this episode, we ask you to keep listening. Sometimes, someone's processing their thoughts or it's part of the natural flow of conversation. Please introduce yourself.
Good morning, everyone. Again, Kayla, thank you so much for having me. It's been quite the airway journey for me over the past, dare I say, 40 years. Please don't do the math. But my journey began in a respiratory therapy program back in the early 80s. And then I found my way into nursing. I thought I wanted to be a veterinary technician, but I was not Dr. Doolittle. So I found my way into nursing, into critical care nursing specifically, flight nursing as a flight nurse with the Air Force Reserves for the United States, and then into the industry side of things with medical devices and the vagus nerve stimulators when it started, and then in the ENT world, then sleep, then a little bit of dental, and then into airway function, where I brought over and commercially first promoted a device called four-phase rhinomanometry. And that's really one of my favorite devices and instruments to use to look at airway function, how the nose is working, and how airflow is coming in against the natural pressures that we have in our nose. So, this creates a lot of opportunity to discuss what the nose does, why it's so important, and for you, Kay, how this plays a role in neurodivergency. So let's get started.
How different is respiratory than airway health?
Yeah, so respiration is our act of breathing, it's inhalation, exhalation. But airway health plays a little bit different role. We look at nasal function and what that means. It's a good biomarker that looks at our neurology, cognition, and sleep. So what does that mean? We're taking airflow, how we take air in, inhale, and it's calculated against the natural pressures in our nose, a pressure gradient. And when we look at flow against that pressure, it gives us a biomarker called nasal resistance. And nasal resistance, we all have a natural level, so the nose can work the way it's supposed to work. Filter, humidify the air before it gets to the lungs, clean up the air before it gets to the lungs. But what's really important is that nasal resistance at each level, as it increases, something physiologically happens to our body where it can start out as mouth breathing. It can get into posture compensation. It can get into different diseases or mental health issues. Anxiety can increase. Depression can increase. More symptoms of ADHD like behavior can increase. So now you can see how it's all connected. So just to recap, respiration is taking air in and out. Nasal function and airway health is a little bit more complex.
Is nasal resistance good?
Nasal resistance is good to a limit. We all need a little bit of nasal resistance so the nose can work the way it's supposed to work. That nasal resistance slows the air down so the nose can filter and do all its magic, create nitric oxide in the paranasal sinuses so that the vascular part of our lungs and our body can work a little bit better. So the short answer is yes, Nasal resistance is good within the normal limit for a particular person. Everybody needs a little bit of nasal resistance, and it's all dependent and very individual to each of us. But too much, now we get into diseases like sleep apnea,
Mm.
neurodivergent issues. Yes.
How does nasal breathing influence brain development, oxygenation, and
Oh, gosh.
regulation?
Yes, that's such a complex question, but a very good question. We're finding more and more in research how cognition is affected by airflow. So the basic science is this: we have in our nose, right about here, close to our eyes, which is called an olfactory bulb. Now we have cranial nerves as well. We have 12 of them. And the first cranial nerve is olfactory. That nerve and the optic nerve are the two cranial nerves, the only cranial nerves that have a beeline messaging system to the brain. So, what does this mean? As air comes in the nose, it goes up what's called the olfactory cleft to the olfactory bulb. We have millions and millions of neuroreceptors that sense airflow, how fast it's coming in, and the temperature. And if that is limited, it does what we call a limited brain activity. There are studies that show how nasal breathing helps make brain waves work better than mouth breathing. And that's from the Zalando study from back in 2016. And it's Zelano, Zalano. So they looked at brainwave mapping and EEGs to find that when we breathe through our nose, the occipital brain waves are very nice and rounded, like we want to see. But when we mouth breathe, they flatten out. And that can eventually create some form of hypoxia. Hypoxia is low oxygen.
What if you have issues blowing your nose due to neurodivergent?
Ooh, that is such a good question. That is a tricky one. It's not so much
Yeah.
blowing our nose. It's not so much blowing our nose, but it's being able to take air in because our brain has it's in the medulla, um, uh, the pons and the medulla oblongata. That's the respiratory center. That's what triggers us to breathe, right? Now, if there's a neurological highway that's broken, that messaging gets broken and it can affect how we can breathe through our nose, blow
Mm.
out of our nose. Is that you? Yeah, 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 yeah. So that's a great question. I love that question. But yeah, it's that nervous system communication, and even in EDS, we see that a lot. Patients with EDS, where they can have problems with nasal function, airway function because of lack of collagen. So there's another thing to consider as well. Not only our nervous system, but the amount of collagen that we have.
What is EDS?
That is the Arrows Down syndrome. Oh gosh, I can never pronounce it correctly, but it's EHLERS, Ehlers Danlos syndrome. I apologize for the pronunciation of it, but that is a situation where there's less collagen in the body and it's hypermobility. So a lot of times people with neurodivergency might have hypermobility and vice versa. That's something to think about as well.
What does collagen do?
Collagen is so important in our skin. It's part of the cell structure and our skin structure to keep everything together. So it's a building block. And it's a lot of amino acids and proteins. And we need that to keep our skin intact, to keep our organs intact, to keep everything in our body in place.
What are some signs that a child's breathing may be affecting their development?
Oh, that's such a good question. And Kayla, there's such a huge movement and momentum in children and airway issues. So the most common one is their mouth breathing. Um, a few other are you can see like shiners under the eyes. It almost looks like they have a black eye, or they're really tired, like bags under your eyes. But we call them shiners. That's a very obvious one. Mouth breathing, very obvious. Now, let me just stop right there because mouth breathing happens and it's not abnormal per se. So, when a child has a cold or when they have allergies, they're going to mouth breathe because they can't breathe through their nose. And that's what we call it's acute mouth breathing, meaning it's very short term. And then they go back to nasal breathing. The problem is when we see our children, and what I like is that if children, you can sneak around the corner as they're watching TV or playing video games or doing homework and take a look and see how they're breathing. If they're sitting there with their mouth open and breathing through their mouth more than about 50% of the day, that's a problem. That's a problem. And if you
And
see
it
it
could
over,
result in drooling.
yeah, drooling and your lips get chapped. I saw that with my son. But one thing that I'm seeing in my practice and amongst other populations and conversations that I'm having with parents, this is very interesting. And I made a mistake in my son. I thought straight teeth, baby teeth, were a good thing. That's not true. Baby teeth should have a space between them. That space is so important for when the adult teeth come in. So, what happens is I'm beginning to see children that don't have that space between their teeth, and that's a cue that that could be an airway problem because when the adult teeth come in, we're going to have crowding. So let's talk about that. And we talk about you'll hear the term craniofacial development. It's huge. It's all over social media. And what that means is when we can't breathe through our nose for a period of time, a long period of time, and we revert to the emergency exit route, mouth breathing, like a plane, the emergency exit is an open window. In us, an emergency exit is our mouth. We open our mouth. And over a long period of time, what happens is the face becomes longer and longer and longer. The nose might change a shape. You might see a little bit of a deviated septum. And all that is, think of a pup tent. It's like this, and it just kind of collapses. Now, there's a term that they use in medicine. It's called adenoid facies. So the face gets longer and very narrow, and you can see it. Now, it happens over time. But again, shiners, mouth breathing, drooling, not sleeping well, snoring, different behavior changes where they really just can't pay attention. Not an ADHD diagnosis, but a behavior like ADHD. They just can't focus and concentrate. Poor school and academic work.
What about TMJ?
Oh gosh. So that is very interesting. I've done some work with some dentists looking at TMJ. And I love this question because about 60 to 70% of the population has maybe about 60% of the patient population might have a TMJ problem. Ah, of that, those that have a TMJ problem, and I talk about this in my first book, 70% of those patients have a nasal function problem. What does that mean? And here's the neurology behind it. And what we're finding is that the bite force and pressure, how you bring your back molars together, sends a nerve signal to what's called the trigeminal ganglion root. The trigeminal nerve is the fifth of 12 cranial nerves. The trigeminal nerve is as it's as if you put a big spider on your face. It
Mm.
covers your entire face. The trigeminal nerve is broken down into three sections. V1, which is up here on your forehead, V2 is the nose, and V3 is the upper lip and or the lower lip and your jaw. Now, V1 and V2 are more sensory, right? V3 is sensory and motor. So the way you can bite on something, and this is where you get into bruxism or teeth grinding, which can be another symptom of an airway problem in a child. But that the whole trigeminal nerve sends these signals back to the brain and then it goes back to the nose. And they all talk within one another. And we call it the V2, V3 biofeedback loop. Kayla, one thing I want to touch on, because I had a note here. When we look at nasal breathing influencing brain development and regulation, when we nasal breathe, that improves our oxygen efficiency and our carbon dioxide balance. Now, I used to see this a lot on my ventilator patients in the ICU, where we had to balance oxygen and carbon dioxide. And if we have low oxygen, we have a problem. If we have low CO2, that can also be a trigger as well. And we call those hyper and hypo um, uh, respiratory issues. So they're either respiratory acidosis or respiratory alkalosis. What does this mean? We all have a natural pH balance in our blood. Our blood has to be in homeostasis or balance, right? And if that oxygen and CO2 is off, that pH in our blood can go up or it can go down. And that affects the way we function. It does a lot. And I used to see this in a lot of my traumatic brain injury patients that we have in the ICU. We have to keep that balance between oxygen and CO2. So important. And nasal breathing plays a huge role in that.
Is nasal function related to sensory or motor?
More sensory, because we have neuroreceptors and mechanical, millions of them in our nose. Mechanical receptors, neuroreceptors. I talk about this in book number 2. The nose has over 60 functions. And I talk about how it can detect chemicals, danger. And if we sense danger, we breathe a little faster.
Mm.
So we start breathing through our mouth. Um, that sense of smell, plays a huge role in how we can function as well. Mm-hmm.
Yeah.
What happens in the body when nasal breathing isn't functioning properly?
Yeah, that's a good question. A few things can happen. We drop the amount of oxygen, right? And that can trigger a whole response in our body. When we're nasal breathing, a lot of the connection between the nose and the brain also has to deal with the limbic system. That influences our memory, our emotion, um, our neurodevelopment. And it can really have an impact where if we don't have that stable breathing and stable nasal function, it can send us into what's called a fight or flight. We breathe a little faster.
Mm.
Our heart rate goes a little faster. And that's where we can do a lot of breath work exercises, breathing exercises, where you can breathe in for 4 seconds. Now, you'll hear, oh, breathe 6 times a minute. Now, I never had a patient on a ventilator less than 10 breaths per minute. So in my world, if you came in with breathing less than 10, I'm going to look for drug side effects, brain injuries, thyroid issues, things like that, right? I'm going to look for that. But when we're in a state of panic, there are breathing exercises. We can breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds, hold it 4 seconds. Because when we breathe in, by breathing in, our heart rate actually slows down a little bit because of all the pressure we bring in on breathing with our chest. It actually can slow down our breathing a bit and so our heart rate. Caleb, there was one question you had for me about how early can these nasal function dysfunctions happen? This is really important because these can
What
happen
if you
early.
can't hold it for four
Oh,
seconds?
so if you can't hold it for 4 seconds, you can train yourself to slowly get to that point. Maybe hold it for 2 seconds or 3 seconds, and then gradually build yourself up to that amount.
How early can these patterns begin? And what might we be missing in infants and children?
Oh, I love this question. So, about 3 years ago, I created a little algorithm, a little exam called Maverick. And I'm a military girl, so each letter means something. And the Maverick nasal exam, facial analysis, and posture adaptation means something. When I look at a baby, the first thing I look at are the nostrils. The nostrils can tell you a story like none other. And what's interesting, a lot of babies that have a problem breathing through their nose, 20% of them have a deviated septum. So, what does that mean? If they're coming through the birth canal, the way the baby turns, because the nose is the only part of the body that's the most projectile, it can actually hit the vertebra or the backbone of the mom and the hips and actually cause a little bit of a deviation. And if the baby gets stuck, it's lacking oxygen. So that can have some brain development issues as well, right? But when I look at a baby, I look at the eyes, but the number one thing I look at is the nose. And I look at the philtrum just to make sure it's in the center, because that will tell me a lot as to the position of the nose in the front part. It means a lot because that could be a nerve impingement that's going to affect feeding, especially if you're breastfeeding. How is the baby latching? Because they will say, oh, a baby's colic. Is the baby colicky or is the baby having an airway issue and can't breathe and can't sleep? And the nose is also connected to digestive issues, which I've coined as the gut nose axis. They talk. And here's what's important: an inflamed nose is a sign of inflammation in the body. Something isn't right. I call the nose a very reactive organ. It senses my handle is the nose knows. The nose truly knows what is happening. It's a detector, it's a signal, it's a pressure regulator, controlling the pressures in our body. We have about 8 to 10 pressures that help us breathe. And one of those pressures are out of sync, it's a domino effect. They become all out of sync.
What can the nostril tell you?
Oh gosh. So there's a thing that we look at when we look at nasal function. It's called partition of airflow. What does that mean? Partition of airflow is, think of it like this. We have two noses. 50% of the air comes on this side and 50% of the air comes on this side. When the nose begins to deviate and cut off the air on one side, now that partition of airflow becomes 60-40, 70-30, 90-10, 80-20. And as that partition of airflow changes, our nasal function can get worse. What does that mean? Kids have and babies have round, cute nostrils until about the age of 7 when they become triangular like an adult, right? If you see one nostril a different shape, a different size than the other, that's a cue that there's going to be a problem with the air coming in the nose equally, 50-50. But that's going to lead into problems down the road. Now, I've also worked on the genetic side of things, and I was able to do a lot of genetic pairing. And I'm close, but I'm working on a genetic panel where I could be able to swab a baby, run a genetic panel, look at the variants of the different genes in the swab, and know if a baby's going to have an airway problem or a sleep problem 3 to 5 years down the road. That's important.
Isn't genetics just a chance?
It is. Genetics is one component. We also have to look at the environment. The environment could mean noise pollution, air pollution, access to good quality food and nutrition. You've heard the term, maybe it's called food deserts, meaning, so food deserts are, think of rural health, and they have one grocery store. For example, one of my PhD students, so I teach at Liberty University, I teach health policy and health economics and medical billing and coding. And one of my PhD students, I was her dissertation chair. So I walked her through the process of completing that dissertation, defending it, and walked her to graduation. And what was interesting is she was in the outskirts, the rural area of Houston. And in her findings, what was really interesting is that she found one grocery store in the area. And what we're finding is a lot of the rural areas, there's very limited amount of food access, quality food access, meaning there's one or two grocery stores for a 10-mile radius. And when we think about that, are they getting processed foods? What kind of foods and nutrition are they getting? That also plays a role. You'll hear the word epigenetics. And so genetics do play a role. It's a good biomarker to look at. But beyond that, is there lead? Is there mold? So many different variables we have to look at and consider.
And if they are eating enough.
Ah, it's not a matter if they're eating enough, but what they're eating. And even when we're eating the right things, Kayla, we can still have problems. My son is a good example. I thought I was doing everything right. Here's a catch: my son did not have the spaces between his teeth. I didn't know that wasn't normal. And that was 20 years ago. But what I did do is he had apples, carrots, celery, nuts. He had chewy, hard things to really develop the jaw, to develop the muscles that would develop his face. But even though he had good nutrition, even though he had good quality air, and even though we're not in a food desert, we're in the suburbs, um, we still had the issue of an airway problem. His teeth told the story. And then he had big tonsils, big adenoids. So, to your point, genetics, it's not an end all do all, but it is a consideration.
And if they are absorbing enough.
Exactly. That's the other component. Remember, an inflamed nose is a sign of inflammation in the body. So, if you're having gut issues, how much of that food and nutrients are actually being absorbed? And we could go on and on because I had a pro athlete who had his tonsils out, sleep study, saw a dentist for an oral appliance. And I looked at him and I saw the deviated nose and I said, no matter what you do in the mouth, that nose has to work. And he mentioned that he had an injury. And when I look at people, I look at the shoulders in particular, that tells me a lot. And I could see the one shoulder was down because he's trying to get that air in the other side, right? And that posture compensation caused an injury and he had to have surgery. That's important in older people because you could have a tendency to fall, right?
Mm.
But what had happened was he had Crohn's disease, and his Crohn's disease inflamed, and he was getting on a new medication. So that was making his breathing more difficult because it was kind of a signal from the gut to the nose. Yeah.
You've developed tools like the Daphne score and advanced rhinomanometry. How are these changing the way we understand airway health?
I love this question. So, rhinomanometry, the concept has been around since about 1894, 1895. So, it's an old concept. But it's Dr. Klaus Vaught, who is an ENT, a dentist, and an oral maxillofacial surgeon, who said, I can't really tell what my patients are doing after sinus surgery. So in the 60s, he created this computerized rhinomanometer. And back in the day, rhinomanometer, it only looked at one portion of the breathing cycle. So now it's like a four phase, and we're getting to more phases. What does that mean? When I look at a respiratory cycle, a breathing in and out cycle, there are four breathing patterns, two on inspiratory and two on expiratory. So when I look at a tracing, the device is called a four-phase rhinomanometer, and it's on my Instagram page. You can see me doing a test. And what I'm looking at is how is that tracing going? Now, as a critical care nurse and a flight nurse, everything I looked at was numbers and tracings.
Mm.
And when we look at that, that tells us a lot as far as a deviated septum, what's the tongue doing, how the pressure is changing when we breathe in. The problem was there was no data interpretation. So I was VP of the company at the time, and they said, well, we can't practice medicine. Well, you can't practice medicine, but I can. I have a license.
Mm.
So 5.5 years, 754 papers, and nearly 1,000 tracings. I looked at all these different things that were happening on these tests and took over 200 variables and wrote a whole coding, wrote a whole software so that I could teach providers what is normal and what is not normal on these tests. So that's Daphne. And I woke up at 4:37 in the morning in April of 2022 and said, "Oh, that's the name." And then I launched it. And what's interesting is I was talking Airway AI before ChatGPT came out in October of
Mm.
22.
Mhm.
So how cool is that? So I was already looking at patterns and machine learning before it became popular. But what does this mean? Now providers can put in the inspiratory resistance, which is a true indicator of treatments, how the patient's doing, what our outcomes look like. And I can take that, put it into Daphne, and it can tell you normal, abnormal. What are some suggestions for care? What are some suggestions as far as interdisciplinary actions and working with other specialties? So Daphne came out in 2022. So it's been 4 years and the first in the world to really interpret this data. Some people have gone to Chat GPT and try to copy it, but you can't copy it. Chat
Mm.
GPT isn't always correct.
What needs to change in education, policy, or clinical practice?
Oh, I love this question. So let's start with education. Academia rules, and we have to teach our medical students, osteopathic students, nursing students, child development. We have to teach them what are these signs and what we need to look at in children that have airway and sleep problems. We have to teach this in these academia schools. Next, a lot of insurances cover a nasal function test. That was part of my PhD defense, looking at health policy. A lot of insurance companies will cover it, but there's two that don't because they say it's experimental, even though it's FDA cleared. Clinical practice, we have to consider nasal resistance as a biomarker. Everyone has a different level that's normal for them. We have to monitor that resistance to make sure our treatments are not overexpanding or overdoing what we need to get done, or make sure they're not deficient in what we're doing. And that is key too. So we have to find that balance, called like a airway homeostasis. We have to find that balance between flow and pressure and what we're doing, because that is going to trigger so many different things neurologically, physically, sleep, across the board. It has to be a
Thank you
standard
for
of care.
joining me.
I'm sorry.
Thank you for joining me.